What is endometriosis, how it is diagnosed, and how it is treated?
Endometriosis is a condition where the lining of the uterus is present outside the uterus. So normally in a particular cycle, if a woman does not get pregnant, the inner lining of the uterus comes out as the menses. But instead of coming out completely, if this uterine lining goes backwards through the fallopian tubes and enters the abdominal cavity, it may get stuck here and there. And every time that a woman bleeds, there are bleedings happening within the abdominal cavity. Sometimes these act as glue and cause the various organs inside to get stuck to each other. For example, the ovaries, the tubes, the uterus, they may all get stuck to each other. The bowel may get stuck to the uterus. And this alters the relationship between these organs and may cause delay in conception. How we diagnose endometriosis is one from the history. If a woman has very painful period, especially if the period starts before the onset of periods, then we are suspicious of endometriosis. When we do an internal examination and find there are some painful nodules, that is also suggestive of endometriosis. If on ultrasound we find that the uterus and ovaries are stuck, or there are things called chocolate cysts in the ovaries, that is diagnostic of endometriosis. And the final proof comes when we do a laparoscopy and we are able to find out whether endometriosis is there or not, and whether it is in stage 1, 2, 3 or 4. Final proof is when we send some tissue for diagnosis and the pathologist looks at the tissue under the microscope and confirms the diagnosis of endometriosis.